What Kevin loves most about it, is helping people, and it's a way we grew up in this small town. You help each other. So Kevin's stroke occurred November 28th, 2010. They discovered is that he had what's called a dissection of his carotid artery. First thing I had to do is have to kind of repair where he had the tear. They had to clean out where the tear was. They put 2 stents in. From what I understand, oftentimes people, perish when they have something like this, but Kevin's a tough farm boy from Waverly. What you hear is that most of the recovery is in 1 year, and there's very little to no recovery after 1 year. No, is it true? Look at this. Up until just a couple months ago, Kevin couldn't lift that arm. What do you think about that? And this is why Kevin also was such a great doctor, is that he's always relentless in his pursuit of always improving and getting better.
He's had a career that's looked at a lot of different things. He's always been interested in the process of care and how to make it more efficient and to use fewer resources, but to be better targeted. Kevin would take over a patient's care in a way that a subspecialist often would not, and that he would look at all the different aspects.
The Heart of New Ulm project is really important to Kevin because this is something that he had championed many years ago. The people in New Ulm were having strokes and heart attacks in their 40s at a very young age, when a lot of the focus was more on kind of devices and stents and angioplasty. Kevin was kind of swimming upstream a little bit and saying, there's some simple things we can do that we can just make lifestyle adjustments, and then you won't have to have these angioplasties and stents and more invasive procedures later on in life. Coming to fruition now, the 10-year study will be done in a couple of years. You have this meaningful data which will be used nationally and internationally. Yeah. So this means a lot that people are still appreciating what Kevin has done and that they haven't forgotten about him. And I think it just shows a lot about the kind of the medical field.
He had a really bad thing happen to him, and yet never has he looked depressed. He's always moving forward, which is absolutely characteristic for him. And so as a result, you really like to be around him.
Thank you.
All right.
Mr. Bojangles, Mr. Bojangles, Mr. Bojangles.